Welcome to the Expert Series, brought to you by the Lupus Foundation of America. Our health education team is here to bring you experts in lupus to discuss topics to help you live better. Thank you for tuning in to today's episode. My name is Melissa, and I'll be your host. I am very excited to welcome Dr. Birru Talabi, who will be answering our questions about lupus and menopause. Mehret Birru Talabi specializes in rheumatology and is certified in rheumatology and internal medicine by the American Board of Internal Medicine. She practices at the University of Pittsburgh Physicians, Department of Medicine, and Division of Rheumatology. She completed her fellowship, residency, and medical degree at the University of Pittsburgh School of Medicine, with concentrations in women's health. She also completed a PhD in epidemiology at the University of Pittsburgh School of Public Health, and her dissertation work focused on the menopause transition. We're delighted to have you join us today, Dr. Birru Talabi.
Well, I am delighted to join you. Thank you so much for the invitation. And it's always so great to talk about menopause, such an important time frame in people's lives.
Yeah, I agree. So thank you again for joining us, and we'll just get started. So we know that, just some basics, 9 out of 10 people who develop lupus are women. So we're talking today about menopause, a part of life and health that just about every woman will go through. We don't talk very much about menopause, or maybe not as much as we should. And I think, like I said, it will happen to almost all women. It's a significant time of life, and I'd like to know more about it and how it affects women with lupus. So, we'll get started just with the fundamentals, and I'll just ask the first question, which is, can you define the different stages of menopause and explain how they interact with lupus in terms of symptoms, disease activity, and just a woman's overall health?
Absolutely. So, Melissa, what I would say is, just to support what you just said, menopause is a really important transition in people's lives. It can be a very affirming time. People don't have to deal with periods anymore, some of which may have been problematic or painful. There are other life changes that can be occurring during the menopause transition that can lead to some freedoms and the ability of people really to center themselves. That being said, menopause can be challenging for people. And I think the more we study it and understand it, the better we can start to develop resources for people who are undergoing menopause that might be grounded more in science and relevant to people's experiences going through this change of life. Really, really pertinent to lupus. Lupus, as you mentioned, disproportionately affects females, and many people with lupus will be going through this menopause transitions. With that being said, to try to answer your question, I'm going to start a little broadly and then get more specific to lupus.
Great.
Menopause is a point in a woman's life when menstrual periods have stopped for 12 months. And what's going on there is we have these ovarian follicles, these little sacs in our ovaries that contain unfertilized eggs. And women are born with about 1 million of these follicles, and then the number drops precipitously, dramatically over the menopause transition, down to about 1,000 by the time people are ready for menopause. And then perimenopause is this time frame in which the number of follicles is dropping, and it's associated with hormone shifts that are leading to relatively low levels of estrogen in the body. Estrogen being a really important sex hormone that men have estrogens too, but we as women have more estrogen than men, and it's an important sex hormone for us. So as the menopause transition is happening and perimenopause is happening, or that transition point between having your period and losing your period, again, there are lots of hormone shifts, and those hormone shifts give you some of the symptoms that people will experience over menopause. So when you ask about the different stages of menopause, there are early stages and later stages of menopause. So in the early stages of menopause, people may notice that there is some menstrual irregularity. They may start to notice night sweats and hot flashes. Those are called vasomotor symptoms. Vaso, like blood vessel, motor being activities. So lots of blood vessel type activities, night sweats, aches and pains that start to occur in people, dryness of the skin, etc. So some of these things can start to happen in the early stages of menopause. And then in the later stages of menopause, people may start dropping periods altogether. They may miss a cycle, for example. And so that can certainly be something the later stage of menopause can herald or bring about. Now, you asked about how these different stages of menopause might interact with lupus in terms of symptoms and disease activity and overall health. One way to answer this is to keep in mind that the cells in our immune systems actually have estrogen receptors on them. And I think that's really, really an important thing to keep in the back of your mind. Estrogen is interacting with our immune system. And in fact, estrogen may play a role in the development of some autoimmune diseases and disorders. And there have been some associations between estrogen and lupus. And as you mentioned, Melissa, 9 out of every 10 people with lupus is a woman. And there's some thought that estrogen may be playing a really important role in the development of lupus. So as these fluctuations are happening in hormones, and estrogen levels are sort of rising and falling during the menopause transition, people may start to experience perhaps a little bit of disease activity or feeling like their disease might be a little more active. But by the time that people have undergone the menopause transition, people with lupus, often they feel that their lupus has gotten less active. So when people transition into menopause and there's less estrogen in the system, they tend to feel that their lupus is better controlled. And that's been documented in a number of studies.
Okay, so as once someone is fully through menopause, they can experience less disease activity, you think, and in part because of the lower estrogen levels.
That's one thought, that maybe it's the lower estrogen levels because, when we think about lupus also, it tends to be a disease of reproductive age people. It's much rarer for older people or menopausal people to develop lupus. So, that all sort of fits into this idea that estrogen is playing a role. The more estrogen you've got on board, perhaps the greater likelihood that you might develop lupus or might have more active lupus. But after the menopause transition, when estrogen levels fall, that might also correlate or relate to people having less active lupus.
And that's really interesting. And I guess maybe kind of a relief, maybe a bit of a payoff for going through all of the hot flashes and night sweats. So, how can I ask you, just sort of as a follow up, how long does it take for someone? Right now, we'll just focus on someone with lupus rather than generally. How long would it take generally someone with lupus to get through menopause from the beginnings of perimenopause all the way to where you become, I guess, post menopause?
So really, really good question, and one that we're not so sure about for lupus patients. But what I would say broadly is this menopause transition, again called perimenopause, it tends to last for about 4 years on average. That being said, there's a lot of variability in that. Right? There are some people who will have perimenopause symptoms for 10 years, and there are some who will have it for a much shorter period of time. But on average, this transition appears to last for about 4 years.
Okay. And I've read or seen that some people with lupus experience early menopause. So is there any idea? So first of all, is this the case? And what factors contribute to that?
Yeah, Melissa, I think there is some suggestion that some people with lupus will experience early menopause. And early menopause just means that menopause is happening between ages 40 and 45. There are some other, I think, important factors to think about when it comes to people going through early menopause and lupus. And one of them is called primary ovarian insufficiency. That's when menopause happens before age 40. It's actually very rare in the general population. But one of the reasons and one of the causes of premature ovarian failure, or people's ovaries sort of petering out before one would expect, is because of the medications that we sometimes use in lupus. And there's one in particular, cyclophosphamide, that can be used in severe lupus. Some people with lupus who have nephritis, where the lupus affects their kidneys, or who have central nervous system lupus, may be exposed to cyclophosphamide. It's an effective medication, but it does affect the ovaries. And the range of premature ovarian failure for people who've been exposed to this medication, which again is really effective at treating lupus, but has this other side effect. The range is 11 to 59% of people who get Cytoxan for any reason. If you're younger at the time that you get the Cytoxan, then there's actually a better chance that you'll continue to have periods. But if you are older at the time that you're exposed to cyclophosphamide, or if you have higher doses of cyclophosphamide, you might be at risk for experiencing primary ovarian failure. And then just to answer your question in a different way, outside of medications used for lupus that might lead to early menopause, there's some suggestion that autoimmunity can be associated in certain causes. And it doesn't look like it's lupus, actually. It looks like it's more related to autoimmune thyroid disease. So if people have heard of Hashimoto's, for example, in which a person's thyroid is being attacked by their immune system, there is this association between autoimmune thyroid disease and early menopause. And the reason why it's worth mentioning that is many patients and people who have lupus also have thyroid disease. So that might be one way that people with lupus might experience early menopause, not so much because of the lupus, again, but if they have autoimmunity.
Wow. So it sounds like there are really kind of four factors at play, right? There's first the natural transition um, that most women will go through, that is menopause. And then there's for women who have lupus going through menopause, there's the sort of added complicating factor of having lupus. And then there's an added complicating factor of some medications that you might take to control your lupus. And then finally, a complicating factor of having an overlapping autoimmune disease, which many, many people with lupus do, that might further kind of be in the mix and sort of affect the way that you as a person with lupus experience menopause.
That's right. Again, I think many people with lupus, just having lupus, people's disease experiences are so different, right? One person's experience of lupus might be very different from somebody else's experience of lupus. And I think the same applies for people with lupus who are undergoing menopause for all of these different factors, including their genetics, right? When did mom go through menopause? What was her menopause like? There are a lot of factors here that make this a very individualized process for people. So just like in any aspect of lupus, there are some general principles, but people's experiences are going to be really, really unique and individualized to them.
Yes, I think if there's one thing that we can say about every person with lupus, it's that their journey will be unique. So we definitely see that a lot. I want to ask, I know you talked about hormone levels and immune cells having estrogen receptors. What does this mean for people who are interested in hormone replacement therapy? Either to mitigate the symptoms of menopause or to maybe kind of stave off menopause a bit. I know that estrogen hormone replacement therapy is recommended far less for the general population than it used to be. But is it ever recommended at all for people with lupus to undergo hormone replacement therapy?
So, Melissa, now we're talking about a subject that is very near and dear to my heart replacement therapy. Um, so I think I want to just frame my answer first in saying, again, everybody's risk factors, everybody is going through lupus and menopause and life in an individualized kind of way. There are some basic general principles, but for what I'm going to talk about, I think it's so important to talk about your individualized, your personal risks with your physician team, with your healthcare providers, because some of the things I'm going to talk about might apply to you and some of them may not. And certainly in what I'm going to say, this is not a one size fits all. It's just to provoke and stimulate some conversation, I think, and some questions that you might ask your healthcare team to get some clarity around the safety of hormone replacement therapy. So, Melissa, as you alluded to, and as I've already discussed, we do suspect that estrogen has something to do with lupus. And exogenous estrogen, exogenous meaning outside of the body, so estrogen that you might take in a pill form or in a patch form, etc., has in the past been associated with some degree of the development of lupus. And the example here is actually with oral contraception. So back in the day, many, many, many years ago, let's say if you're going through menopause now, it might have been your parent who might have been exposed to the old types of oral contraception that had estrogen, where the doses were super, super high. And back then at those high doses of oral contraception, young, healthy women who were taking those seemed to have a slightly different risk of developing lupus or anti-nuclear antibodies than young, healthy women who didn't take the estrogen-containing oral contraceptive pill.
Okay.
We don't see that association now. I just want to mention that because the current forms of oral contraception have really, really, really low doses of estrogen. And in fact, if somebody's lupus is stable and well controlled, estrogen is perfectly safe to add to one's birth control in the context of lupus. But back in the day, again, with high doses of estrogen, there was this association maybe that there was an increased risk of developing lupus, perhaps even more severe lupus. So I want to mention that first. That has led to, I think, some concern about whether hormone replacement therapy, which basically is another form of exogenous estrogen or estrogen that's given in a pill or a ring or a patch form, if that might be safe for people with lupus, given these old associations. The other issue to bring up, though, is that some people have very serious symptoms of menopause, and menopause that really affects their quality of life. Drenching sweats, heat waves, flushing, night sweats, sleep disturbances, sexual dysfunction. And the most effective treatment overall for those vasomotor symptoms that we've been talking about, those sweats and flushing, is actually a mix of estrogen and progestin for people who've got a uterus and estrogen only for people who don't have a uterus, such as a woman who've already had hysterectomies. So the question then is, we've got a really effective treatment in hormone replacement therapy for some of the most problematic and disturbing symptoms of menopause, but is it safe to use for people with lupus who have this safety signal around taking estrogen from outside of the body and using it to manage certain symptoms? There is generally, like you mentioned, Melissa, I think an impulse not to treat menopause with hormone replacement therapy. And that's based on data from the Women's Health Initiative. That's one of the data sets that I used in my PhD research, actually, on menopause. And back then, there was some suggestion that hormone replacement therapy increased the risk of breast cancer. I think what we know now is probably that risk was overstated. And I think that has led to people underutilizing hormone replacement therapy. I do believe that hormone replacement therapy, when you really look at the data, is safer to use than what we thought 20, 25 years ago. And so what we see now is that we're actually starting to observe slightly higher rates of hormone replacement therapy utilization because we've got to balance safety with quality of life. This is all a balance. Are you following me so far, Melissa?
I am. This is very interesting. I wasn't aware that the newer research on hormone replacement therapy had kind of changed perhaps that risk profile for different people.
Yeah, I mean, in actuality, there really are few contraindications to using hormone replacement therapy. If you've had a history of breast cancer or another type of cancer that relies on estrogen to grow, you might want to reconsider estrogen. If you have serious liver disease, if you've had blood clots, and I'm going to get to this point because I think it's very relevant to lupus. If you've had blood clots or are at increased risk of blood clots, or you've had heart attacks or strokes, or if you've got active vaginal bleeding that might be cancer, you probably should not be using estrogen.
Mm-hmm.
That said, there's some people who have had breast cancer who use hormone replacement therapy. Some of these contraindications are really somewhat relative. And again, they have to be individualized and sort of balanced with people's quality of life. But what I would mention is that you notice that lupus is actually not on the list of health conditions for which hormone replacement therapy is thought to be too risky, and the risk outweighs the benefits.
Mm-hmm.
And in fact, the American College of Rheumatology back in 2020 released what we colloquially call it the reproductive health guideline. I was honored to be part of the literature review team. This reproductive health guideline is freely available on the American College of Rheumatology website, and it has a section on menopause. And what we said in that section is people who've got stable lupus can indeed use hormone replacement therapy. Now, again, because of the things that I talked about, people who've got unstable or highly active lupus would be advised to wait until their diseases are more controlled, right? High estrogen levels, perhaps there's this association with disease flare. So maybe we use some of the really effective medications that are available for lupus to try to get the disease under control before starting hormone replacement therapy.
Okay.
But lupus on its own is not a contraindication for using hormone replacement therapy. Said differently, people who are having serious symptoms of menopause and who have lupus could potentially use hormone replacement therapy. And I also want to mention that low estrogen forms of hormone replacement therapy do exist. Vaginal estrogen doesn't release a whole lot of estrogen in the system. There's an ultra low dose estrogen patch that doesn't expose people to a whole lot of estrogen. So there are some relatively low dose forms of hormone replacement therapy that could be especially good alternatives for people with lupus.
Okay. So,
But there's just one, I do want to mention the big question mark around blood.
oh, yes, I think that that is super important to mention.
Yes, and it's this is one of those things again, everything has to be individualized. And I do want to mention that some people with lupus, up to 30 to 40%, so not a small number, are going to have this added challenge of having something called antiphospholipid antibodies, antibodies that increase the risk of blood clots and strokes and heart attacks and potentially miscarriages, stillbirths, etc. People who've had those things may have a disease called antiphospholipid syndrome. Okay. And if you have had a clotting event in the past, a blood clot in your arms, your legs, you've had a stroke or a heart attack, and antiphospholipid antibodies have been detected, right? You've got an increased risk of having another clot just because of this immune factor. And if we give estrogen in that context, we could increase the risk of clots because estrogen all by itself increases the risk of blood clots. So people with lupus who have antiphospholipid antibodies or antiphospholipid syndrome may need to use different types of medication to control their menopause symptoms outside of, and there are medications that are fall in that class. Selective serotonin reuptake inhibitors, SSRIs, selective norepinephrine receptor inhibitors. These are medications that are often used in depression, but can help people who are having these serious vasomotor symptoms or mood symptoms related to menopause transition, for example. That's
So
a lot of information, Melissa.
it is.
But hormone replacement, I think one of the things is, and I just really want to make this point. I do think a lot of people, a lot of women suffer through menopause. And, I think we sometimes are very conservative. When you take a look at the side effects associated with erectile dysfunction medications for men, for example, increased risk of heart attacks, hypotension, or low blood pressure. There are any number of side effects that can happen, but people will use those medications, right? Because for some people, the benefits of the medication outweigh the risks. And I think this is where these individualized conversations have to happen, rather than just saying hormone replacement therapy is off the table for people with lupus, and then telling people that for years they're going to have poor sleep, they're going to have uncontrolled hot flashes, they're going to have mood symptoms, they're going to have sexual dysfunction and headaches and dry skin and joint aches and pains. We have to really make sure we're doing the right calculation on these things.
Yeah. Yeah. I mean, I think that, so one, thank you so much for all that information and for walking us through it. It is incredibly nuanced, and individualized. If I were to have one takeaway from the information, it would be that your quality of life, your day to day quality of life matters, and that your doctor can help you sort through your options in terms of improving your day to day quality of life, right? If the menopause symptoms are difficult to handle, if you're having hot flashes at work and drenched with sweat, and that's all incredibly stressful stuff, and not to get enough sleep, all of that stress can then affect how your lupus is doing, right? Because, you're trying to manage so many things that, you should talk to your doctor. There are things that you can do that are either estrogen related or in some cases not estrogen related, if that is something that doesn't, fit with, what your risk benefit calculation. But it does seem like, what you're saying is that for every person, there is something that can be done if the symptoms of menopause are troubling you, right? If it's affecting your quality of life. And that it shouldn't be just, well, I have lupus, and so I just have to suffer through this. Or what I think is also a common thing is, well, this is just a woman's change, and you just have to put up with it, even if it is seriously affecting your day to day, how you live your life.
And you know what, to be honest, I think that this is one of the main issues in women's health in general. I feel that oftentimes, this is an opinion, this is not fact based. Okay. So, opinion, I feel that, and I'm speaking as a woman myself, as a woman and a physician and a researcher and a clinician and a mom and a daughter and a wife, and all of these different roles, that it can be really hard to center ourselves.
Yeah.
And I think a transition point in which people who transition through menopause, and we know this in part through research that's been done and through talking with people and their lived experiences, that those people who are able to try to center themselves and center their care and taking care of themselves during this menopause transition tend to do better than people who take themselves off the table.
Yeah. Yeah.
If there's any point to get to, that there are ways to try to get through this, and putting yourself on the table and not just suffering through, is I think an important way of not only kind of going through this menopause transition, but actually going through life with lupus as well.
Yeah, I would absolutely agree. I would say that's important for any person with lupus, whether, they're someone who's going to go through menopause or someone who's not going to go through menopause, and at any stage of life. I think we see a lot with lupus because it can be invisible, because often there are symptoms that are hard for people who aren't experiencing them to grasp, like brain fog or fatigue, for people to feel maybe some internalized pressure, maybe some external pressure to kind of minimize how they feel and their quality of life. But I think that the airline metaphor is always good, right? Put your own oxygen mask on first, even if you have so many other people who are depending on you. That's really important, to look after yourself, because then that allows you, not just to have a better quality of life for yourself, but to be more present for, the people that you might be, that you might want to put ahead of yourself. I do think that that's really important. And it's an important part of just the cultural aspect of lupus, in terms of, what women are culturally expected to do, and to kind of put up with and not complain. And so that is going to kind of lead me to my next question, which is about lifestyle factors, and how that can help with symptoms of menopause, things outside of medication that people can do, that often do mean sort of centering yourself and putting time aside for yourself. And those are things like diet and exercise and stress management. In your practice and with your patients, how helpful have you found those lifestyle changes to be for people navigating both lupus and menopause?
Melissa, they're everything. Diet, exercise, and stress management are everything. And we can certainly treat lupus with medications. We can treat menopause with medications. We can do, but there is actually a role of, that people have on acting on their own power to be in the healthiest shape as possible. And that really helps with menopause. And to give an additional frame here, so for my PhD work in menopause, I studied with Dr. Karen Matthews, who is an expert in mind and body. So while I was studying epidemiology and trying to understand epidemics and patterns in the population, my PhD mentor, who I worked with, was really interested and how the mind and the body are connected. And so I learned a lot over those couple of years, just in my own understanding of menopause, as also being the state in which the mind is really important and helping to support the mind. So that really gets into, I think, the importance of exercise. And I'll mention a couple of things here. I think exercise is critically important for a number of different reasons. First, during menopause and then after menopause, Women will gain on average about 1 to 2 pounds per year. And that's very variable. There are some people who are going to put on, 40 pounds over the menopause transition or more. There are going to be some people who lose weight. So 1 to 2 pounds is average. It doesn't really capture the wide range of weight gain or loss here. But what we know is that this weight gain and where it tends to happen is around the belly. And that's really the worst distribution of fat. That's associated with the metabolic syndrome. It increases the risk of type 2 diabetes, strokes, and heart attacks. And we have to really think about blood vessel health and lupus, right? We know that lupus is associated with cardiovascular disease, especially over years of disease. So really making sure to keep your blood vessels in good shape and to keep one's weight down if possible. That is a strategy that exercise can help with. Exercise that builds muscle, like strength training, is important for reversing the natural loss of muscle that starts to happen as estrogen levels decline. It's also really important for managing stress and depression and anxiety. Those are mood issues that can arise or get worse during menopause if people already had pre-existing mood issues. And it's an important way to reduce bone loss. Weight-bearing exercises like walking or running can help to minimize the effects of bone loss because we know that as people lose estrogen, their bones get thinner, leading to conditions like osteoporosis that increases the risk of bone fractures over time. So exercise is super important. Healthy diet, as you mentioned, Melissa, is so important for making sure the bones are healthy, making sure that weight is stable, helping with energy levels. That's important. Smoking cessation. Smoking actually is independently associated with early menopause. It's more associated with severe menopause symptoms. It accelerates bone loss. It increases the risk of all cancer. So I really advocate for smoking cessation. And, it's easy for me to say all of these things. It's easy to say exercise, have a healthy diet, manage your stress, stop smoking. I want to acknowledge that these are difficult things. And for the reasons we were just talking about, it's hard to center one's health and sometimes take the time to do these things. Meal planning is like one of my least favorite things to do.
I know. I'm right there with you. Yeah.
Meal prep, not easy. I acknowledge that. There's a certain level we have to, also acknowledge that for some people who don't have childcare, for whom finances are stretched, and it's hard to get a healthy diet. If you're living in a neighborhood where it's not safe to run or to walk or spend outdoor time, if your stress is because you have a child who's sick or parents who are sick or, job insecurity or financial instability, it's hard to say, just manage your stress. I want to acknowledge that these are challenging things to do. I do think this is one area where we can start to develop better resources for women with lupus who are navigating both having a serious chronic medical condition, menopause transition, right? And all of these other things that tend to be happening during this transition. How do we support healthy diet and exercise and stress management? Easy to say it, harder to live it. And I want to acknowledge that.
Yeah, I think that is an important acknowledgement. And it's tough because, menopause hits right in the time of life when, for a lot of us, we have children who are still at home, even if they're teenagers, right? They still are depending on you, but also our parents are aging. And so, there are a lot of caregiving responsibilities. There are obviously personal responsibilities. And then, as you said, just sort of getting through life. But I think that what I'm hearing you say is that it even just getting started, right? The payoff is so worth it in terms of, not just your future health and possibly, right, the length of your life, right? And how long you get to be on this earth with the people that you love, but also that it can improve your day-to-day experience. I know that sometimes for people with lupus, it's hard because of the fatigue and joint pain. And it feels like getting up and moving will make that worse. It feels counterintuitive, but in truth, getting up and moving, even just a little bit, will make that better for people with lupus. Is that correct?
100%. And in fact, if it's hard, and your joints ache after you exercise, after you take a walk, sometimes what I'll hear is people go to physical therapy, land-based physical therapy, and they're super achy afterward and they have to take 3 days off because it hurts. Aqua therapy, getting into a
Mhm.
pool if that's available to you, letting gravity, dissipate in the water and take some of the pain away, using the buoyancy of the water to start to exercise and move your body. It's just less impact, but it's great cardiovascular exercise. Again, those blood vessels so important to keep healthy when you've got lupus, right? And it's a way to stay active. Again, acknowledging that not everybody has access to a pool, but if there are some of these things, these little changes that can be made, incremental changes that can be made over time, they can add up to a different and a better experience.
Yeah, I think that that's really important. So I just actually have one more question that, I hope will kind of wrap it all up. I feel like we've gotten so much great information from you, from the basic science of menopause all the way through to, important lifestyle changes that people can work on to help them feel better. But I do want to ask about people advocating for themselves and learning more, and what would you recommend for, if you just met someone with lupus, on the train and you were chatting with them and they said, I don't feel great. Menopause is getting me down, but I don't know how to approach this with my doctor. Should I even talk to my rheumatologist about menopause? If it's a man, will he care? How can I advocate for myself? And how can I learn more about getting through this really important time of life? So, what would you say to someone in that situation?
Oh, Melissa, there's so much to say. So, what I would say is, even if your rheumatologist is different from you because of gender, because, whatever the differences are, we are in a service industry. We are meant to serve the patients we help to care for. And so if you have a health issue, a concern, I think it is incredibly important to mention that. And I think when it comes to advocacy, one thing that sometimes, and again, I'm making huge generalizations here, but some people will minimize the symptoms they're going through in their own mind. Oh, this is the change and this is what I should expect. But, again, menopause symptoms can be really disruptive. So don't necessarily minimize the symptoms that you're going through. I also recommend writing those symptoms down, how often they're happening, what those symptoms are, and the effects that they're having on your quality of life. Clinicians want to help, and the more detail that you can provide, I think the better they can help to differentiate between, let's say, menopause or lupus or some other medical conditions that require management. And I think that's another really important point. Sometimes this is not menopause, right?
Mm,
Sometimes these symptoms could be something else. Maybe they're not even lupus. Other
interesting.
things to think about. Maybe we talked about thyroid earlier.
Uh-huh.
If your thyroid is overactive, sometimes we'll see that start to emerge during this menopause transition. That might be vasomotor symptoms, hot flashes, sleep problems. Your brain is not functioning as well. Sometimes, if your thyroid is underactive, that's that Hashimoto's that I was talking about. Again, you might have brain fog, weight gain, dryness, a cold intolerance, mood issues. Sometimes your period is irregular or goes away because of pregnancy. That has happened before, where people are like, well, maybe I'm going through the change and they're actually pregnant.
That would be quite a surprise.
Nice. But there are any number of people I can say in my clinical practice who, were taking birth control or, and found out that they were pregnant, and it was a surprise. Fibroids can cause heavy bleeding. Certain tumors can be associated with hot flashes. Depression can cause sexual dysfunction and weight gain and cognitive issues and physical pain. And again, back to thyroid issues, they can create menstrual irregularity. So, writing some of these things down can be important as a first step to figuring out if there's something else going on. When it comes to lupus flares, one thing that I just want to mention too is that because hormones are fluctuating, a lot of people will experience night sweats. One of the questions that we ask as rheumatologists when we're trying to ascertain or assess whether somebody's lupus is active is whether they're having drenching night sweats. Well, there's a lot of overlap there. Often with lupus, people will have real fevers. Okay. So I would recommend investing in a thermometer, just a basic thermometer. You buy at the dollar store if you wanted to just to start taking your temperature and seeing if you're actually spiking a fever or if this might be something else. Maybe it's menopause symptoms, maybe it's thyroid, etc. So I think when it comes to advocacy, just being aware that not minimizing your symptoms, because it could be something else that could be treated. And again, improve one's quality of life. It could be that this conversation with the physician helps to differentiate between some of the symptoms of lupus that you might have or menopause. And it could be that even just by writing down what these symptoms are and the effect on the quality of life, that you as an individual can start making your own decisions about how you want to treat, let's say, menopause symptoms. Maybe you look at all of the symptoms. I haven't had a good night's sleep in 30 days. And you say, you know what, I might be willing to try a little bit of vaginal estrogen or an estrogen.
Yeah. Yeah, and I symptom tracking I think is really important because it does help you identify patterns as well, right? Where you can look back and say, "Oh, wait, every time this happens, then, there are these sort of consequences and symptoms, or when I get this symptom, it's usually when something else is going on." So I think in general, that's a great thing to do.
Yeah, I mean, we can often look at lupus disease markers and see if somebody's lupus is active. They're not perfect, but we can sometimes get a sense of that. It's harder to test one's hormones for menopause because the hormones are so variable.
Mhm.
So, in some ways, it almost becomes a diagnosis of exclusion. Said differently, your symptoms are really important.
And
Periods is really important. And again, keeping track of those things is what most gynecologists, I think, would sort of say. Many of them will say it's not even worth testing your hormones because at any point in, where you are in menopause, it's hard to understand whether you're in menopause or not.
And you should also share those symptoms with your rheumatologist, right? So even if you're thinking, why would my rheumatologist care about my periods and whether or not they're regular? If there's a change, you should definitely share that with your rheumatologist as well.
100%. I mean, and again, I think the important point here is your whole clinician team. And that's not just a gynecologist, that's your rheumatologist, maybe your primary care doctor, maybe your nephrologist. Your entire team needs to know what's going on with your health. Menopause is a health transition. And it's really, really important to share these symptoms with the whole team to make sure you're getting a really holistic approach and everybody's on the same page. So I would advocate for people advocating to all of their clinicians, not perhaps their, quote unquote women's health providers. As rheumatologists, we're women's health providers also.
Yeah, I think that's a great point to make and really important for people to understand. So, yeah, thank you. And so is there anything that you would recommend for people who are looking for more knowledge on this topic?
Yeah, absolutely. So book club. My good friend just gifted me the book. It's called Grown Woman Talk by Dr. Sharon Malone. She's an OB-GYN in the DC area. Grown Woman Talk. I have no associations with Dr. Malone. I would love to meet her someday, but I don't know her. She doesn't know me. I just thought this was such a great book because I think it provides a nice survey of information about aging with power. And I think I appreciated she provided a lot of information that is widely applicable to people. As a Black woman and physician, I found a lot of information about the experience of the menopause transition for Black people, but it's certainly not limited to any racial group or ethnicity. I just think it has very valuable advice. And I think there are 2 points on this. Is not meant for people with lupus specifically, but I think there are 2 points that I would mention that Dr. Malone highlights. First is that the menopause transition can begin even if you're getting your period regularly. And then Dr. Malone, if you're over 40, you've started the menopause transition. And I think that's such a helpful framing rather than, oh my gosh, am I going through menopause transition or not? Has it started or not? Well, if you're over 40 years old, if you've reached 40 years old,
You're
you
already there.
probably started the menopause transition.
You're on that train.
You're all in that. And so it's a great time to start to center your health and your well-being during what can be a significant transition in life. And I think other resources, there's so much potential for resources that can be developed for women with lupus. And I think there is going to be a renaissance of sorts as menopause in general is getting greater recognition. as being an important time frame in people's lives, and that we'll have more resources for individuals with lupus. There are more medications that are coming out that are non-hormonal, right? That anyone, including lupus patients with antiphospholipid antibodies, might safely be able to use. There are a lot of things that are happening space now. That book that I mentioned is just one of many potential resources, and I think there will be more. But I think just a few starting points, and maybe this podcast might be a starting point for somebody. Hopefully so.
Yeah, I hope so too. And I think we have just had so much information, and we could probably have like a 4-hour podcast on this, but I think that the interest of being mindful of your time and our listeners' time will wrap it up today. And I so appreciate all of the information that you have given us and shared, and also just your perspective. And, I really appreciate kind of the care that you're showing for women who are going through this transition and kind of our day-to-day experiences of living it. And it's been really great to hear all of your advice and your knowledge. So I'll thank you for your time today and for helping us understand. And for those listening in, you can find more information on lupus from the National Resource Center on Lupus by visiting lupus.org/resources. To listen to additional episodes of the Expert Series, you can visit lupus.org/the Expert Series, where you can also subscribe to get alerts when podcasts are released. And I will deviate from my usual script here to say that we do have previous Expert Series episodes on antiphospholipid syndrome and on lupus and pregnancy. So if you're looking for more information on those topics, you can find it in our archives. And finally, if you would like to connect with one of our health education specialists, you can go to lupus.org/health educator or call 1-800-558-0121. And to connect with others with lupus in a supportive and understanding environment, I invite you to check out our virtual and in-person support groups. You can find out how to connect with the right support group for you at lupus.org. Find support near you. Thank you for listening.